Welcome to the video blog. I'm here at the EXL Pharma Communications Conference, and my special guest is Susan Wichkler. Susan is Chief of Staff with the FDA, and it's an honor to have you here on the video blog.
Oh, well, thank you for the opportunity.
Great. Well, you just made a very interesting presentation about some of the changes and what the FDA is doing to improve its own communication and just the whole communications environment. One thing you said that struck me, which you sort of acknowledged, that the FDA is not held in the same regard it used to be, and you're trying to figure out what some of the reasons are for that so you can respond to them.
I think there's a few driving reasons behind that. One is that, in part, certainly now we can communicate so much more quickly, so that if there are problems, they're well known across the country and across the world quickly. There's also just the reality that we have much more science and much more data and information available now, so that we can know that over 1,000 people have been sickened by a certain type of salmonella, where 15 years ago we may not even have been able to detect that, or certainly not to know that it was the exact strain of salmonella. So science has led us to know more things, and I think then that, not handled well, can inspire people to think that things aren't working correctly, when really being able to identify an outbreak or identify a problem with the drug shows the success of the agency, not a problem.
You also made a point that whereas the FDA might be criticized that fewer drugs are being approved and coming to market, that might be more of a function of what's in the pipeline.
It is a reality that we can only approve or review the drugs that we're presented with, and that there has been a decline in some of the drugs that are put into the pipeline. So we can only approve so many out of those. We're not held to a quota by any means, but if there's less coming in, there will be less on the approval side.
So do you ever try and communicate, say, an approval percentage, just so people understand the FDA is really getting the drugs to market? Because you don't really see that as much in the papers as you might expect.
Right. It's a challenging dynamic because there's some information that we may not talk about, and so certainly things that are public we can talk about and describe what's happened, what the agency is doing as it relates to approval ratings. One of the things that's most important in the approval rating discussion is that having meetings with the FDA increases your chance of getting an approval, because it means that the quality of your application is going to be higher. So the idea of communicating extends not only to communicating with the public, but for regulated industry to communicate with FDA.
And that would be a way to eliminate, say, technical problems with the submission, as opposed to whether the medication actually works and says what it's supposed to do. Another thing you're doing that's very forward-thinking and interesting, you spoke about recognizing the importance of communicating to the 10,000 employees at FDA as part of a way to be part of your external communication, and using the commissioner in podcasts known as Andy's Take. Now, how did you convince him to get that going?
Well, actually, the commissioner is very interested in communications issues, so he said, how do I reach my internal FDA audience? How do I reach the American consumer? And we recognized, like many other communicators have recognized, that you no longer need to go through the media to get to the external consumer, that you can get there directly through websites and other things. So his take is his way of trying to explain to the public what's happening. He also communicates with our internal staff each week with comments about kind of what's happening with the agency, and tries to make sure that we're investing in our staff as much as we're investing in the regulated industry.
Now, has that improved engagement from your employees, getting better ideas from them?
It has. We've gotten good feedback about how to communicate things as well as what to do, and I think we've seen a good investment of our people in the agency.
Yeah, now one thing you mentioned, FDA is obviously communicating directly to the consumer and becoming its own media entity, as I think most organizations will be doing if they're smart about it. But the pharmaceutical industry has been a bit hesitant to do that, and they always sort of bring up the big regulatory, we can't do that. Now, if they're not doing any bad things, like pushing off-label things, having patients promote specific brands, and a couple of the other things that might be out there, is there any difference between communicating in the more modern ways where you can actually reach consumers, or a traditional press release? If the content's okay, should they be using these tools?
Absolutely, using new tools, and then with the compliance with the regulations. It's not about, I should say, it's often easy to say, no, we can't do that. And it's harder to say, we could do it if we massage it in a certain way or do things just a little bit differently. Sometimes that harder path takes a little more time, but you get more delivery at the end. So think about FDA's regulations as setting the course and the path for what can be done rather than a stop sign saying what absolutely cannot be done.
Right, and do you think it makes sense that more of the companies engage in these types of communications with the publics, obviously not, going out of what regulations would allow? That's going to help them improve their image because obviously pharmaceutical companies are challenged as well.
I think the more we can help consumers understand what it is that regulated industry does and what the FDA does, you will absolutely have an improvement then in their perception. Where people are challenged and tend to have a negative understanding is when a negative perception is when they don't have an understanding of what's going on.
And one final thought, you mentioned that very few of the FDA employees are actually administration appointees, or people might have a perception that the FDA is sort of a tool of the presidential leadership. Can you give that stat to our audience to give them a more accurate feel for the role of, say, a specific administration and FDA policy?
Sure. Of the about 10,000 employees of the agency, it's just shy of that. There are only 5 political appointees, so 5 out of 10,000, and those 5 are all in the office of the commissioner. They perform a very vital function in helping us interact with the administration, and because we are part of the administration. But the perception that FDA is run by those with a political agenda is simply wrong. We have dedicated scientists, career public servants, and then we're honored to serve with political appointees who have a different role, but a role that's also helpful to the agency.
One final point I forgot to mention from your presentation. FDA is putting up a help wanted sign. You said you're about to hire 1,300 more people. Are any of those in the communications industries, and they recognizing that need to have more people communicating?
We are hiring about 1,300 folks, and some of those are in the communications realm, recognizing that we need to get better at risk communications and just generally helping people understand what it is that we do and understand warnings or approvals and just generally our activity. In order for us to be successful, we have to communicate well.
Great, and so you won't be inundated with resumes. We'll post that link that you included in your presentation if people want to check out the jobs that are available. Thanks so much.
Sure, have a great day.